And we are live.
We'll roll call in 30 seconds here. Stand by. So, good afternoon and welcome to the March 3rd Emergency Advisory Committee meeting. I'll respectfully acknowledge at the outset here that we're having today's meeting on Treaty 6 territory and one of the great homelands of the Métis Nation as well, and we'll look to honor that treaty spirit and the work of reconciliation and inclusion in everything that we do, including today. Roll call now, starting with Councillor McKean.
Good afternoon, Don.
Good afternoon. Councillor Nicol.
Good afternoon.
Thank you. Councillor Paquette.
Good afternoon.
Good afternoon. Councillor Walters.
Good afternoon.
Thank you. Councillor Banga.
Good afternoon.
Thank you. Councillor Carmel.
Good afternoon.
Thank you. Councillor Katarina.
Good afternoon.
Thank you, Councillor Zadek.
Hello.
Thank you, Councillor Essinger.
Good afternoon.
Thank you, Councillor Hamilton.
Good afternoon.
And Councillor Henderson.
Afternoon.
And Councillor Knack.
Good afternoon.
Super duper. Okay. We've got a straightforward agenda before us, but I still need a motion to approve it. Councillor Essinger.
I'm happy to move today's agenda.
Thank you. Don't need a seconder at committee, so please just go ahead and vote.
I'm a yes.
Yes, for Zadok.
Noted. Councillors Zadek and Hamilton are in the affirmative.
And we're also missing Councillor Cartmell's vote, Mr. Chair.
Said he dropped off a minute ago. Tim, are you back?
I'm back. Yes, I'm a yes, Denis. Thank you.
Thank you.
Thank you. Display the vote, please. Carried. The minutes from February 10th. Councillor Knack.
Yes, thank you, Mr. Mayor. I'll move the adoption of the minutes from the February 10th, 2021 Emergency Advisory Committee meeting.
Thank you. Any questions or concerns or errors or omissions arising from the minutes? Not seeing any. Please vote.
Yes.
Yes.
We have all the votes, Mr. Chair.
Display the vote. Carried. Protocol items. I don't think we have any today. So we've only got the one item, so we'll deem 3.1 selected. No request to speak or request for time specific at this point, so we'll go straight into item 3.1. Mr. Corbold.
Thank you, Your Worship and Council. Good afternoon, and I'm pleased to bring today's update on COVID-19 in a verbal report. Joining us remotely are members of VLT, Jen Cluth, the chair of the COVID task team, and of course Dr. Chris Sikora, the Chief Medical Officer of the Edmonton Health Zone. Today's update looks at our current situation and adds more clarity and substance about our recovery plan. To be clear, the level of uncertainty going forward remains, but we are committed to being ready to pivot our efforts towards rebuilding, revitalizing, and resuming our strategic direction. We are cautiously optimistic about the health data trends for Edmonton, but know that we remain vulnerable to rapid transmission episodes until there is widespread public vaccinations by this fall. We're also cautiously optimistic about the easing of restrictions and the measured transition to step 2 of the province's path forward. And finally, the city's role in opening up services and keeping our community safe and being fiscally responsible. So we continue to balance the here and now with the vision of life after COVID and Edmonton's new normal. Hospitalizations continue to trend in the right direction. However, there is some concern for positivity rates and daily active case numbers across the province. This data reminds us that COVID is still active and transmission could easily spike again. The growing presence of COVID variants adds to the cautionary stance of public health officials. This table traces a portion of the unprecedented journey we've been on for the past year, highlights the effectiveness of preventative measures and rules, and shows the strength of our community when we work together. To keep Edmontonians safe, city staff have battled through uncertainty and fear, shown compassion, and learned to be resilient. We acknowledge what a difficult year it's been, and we thank Edmontonians for their sacrifices, compromises, and the support that they've given to their families, neighbours, local businesses, healthcare workers, transit drivers, and other frontline workers. All to keep the community safe. We also acknowledge that until Edmontonians are vaccinated and our economy is restarted, significant challenges remain. One thing that remains steadfast is our commitment to doing what we can to protect residents and employees from the spread of the virus and its variants in the months ahead. Our goal to ensure Edmonton exits the pandemic healthy and fiscally strong is certainly our focus. This chart outlines the steps that have been established by the province to ease restrictions and create a path forward. Monday's announcement of the easing of restrictions puts us in the vicinity of Step 2. Restrictions have been relaxed to allow the partial reopening of fitness centres and libraries. Possible changes to current restrictions for retail, hotels, banquets, community halls, and conference centres have been delayed. This cautionary partial step was made in recognition that some of the leading health indicators, they are the testing positivity rate and active case count, have increased slightly, and there have been increases in the daily number of new variant cases. We are not yet in a place where the broad reopening moves can be made. Libraries will be allowed to reopen as of Monday and with 15% of the fire code capacity, and fitness centers will be allowed to resume low-intensity individual and group workouts for adults. Administration welcomes the opportunity to resume our service delivery to Edmontonians and make it possible for more Edmontonians to have experiences that improve their mental health and well-being. We support the province's Go Slow strategy as it maintains an appropriate level of safety for our community and relies on science to guide the pace of reopening. We are taking a stepped approach to reopening recreation facilities and amenities over the next 2 to 3 weeks. The city will slowly introduce low-intensity fitness opportunities such as group yoga and individual track walking. The advanced booking and reservation system will continue to be used, and all public health measures and capacity limits will be strictly adhered to. We are uncertain about our ability to offer aquatic opportunities at this point, and we are asking and seeking clarity from Alberta Health and other partners of the Life Saving Society. No aquatic facilities are currently planned to be open to the public as part of Step 2. We will explore the public demand and financial feasibility of opening pools in advance of Step 3. Swimming was deemed by the province as a high-intensity activity and is only permitted one-on-one with a certified trainer. You may recall at the last EAC meeting, restrictions were eased for indoor rinks. We presented our plan to open 5 rinks, and then in response to strong demand, we opened up all rinks 2 days later. This measured approach to reopening worked out very well, and it's a model for us to follow as we move into Step 2. It was well received by Edmontonians, and users have shown great compliance to distancing, gathering, and masking requirements that were part of the restriction. Arenas and other facilities relaunched in Step 1 will continue. We will incorporate new programs, services, or rentals permitted under Step 2 where possible. The provincial public health emergency declared on November 24th, 2020 has expired, and with it the authority of our peace officers to enforce the public health orders has also expired. We are seeking an extension of these enforcement authorities, but in the meantime we continue to work with Alberta Health Services and the Edmonton Police Service to monitor and enforce compliance with face coverings under the temporary mandatory face coverings bylaw. And overall mask compliance remains steady once again at 98%. Over the last week, we have seen between 50 to 100 beds available in the shelter system per night. Some locations like Tippinawa may be full, but space remains within the larger system. Throughout the pandemic, Alberta Health Services has been providing guidance to a collaborative group of shelter operators in the areas of shelter regulations, PPE training, and outbreak management. And recently, this group has been discussing new practices to respond to COVID-19 variants and vaccination planning. Individuals in congregated living settings like shelters are included in the province's Phase 2 vaccination rollout schedule. The vaccination of First Nations people over 50 and individuals with high-risk underlying health conditions is scheduled to occur in advance of those living in congregate settings, and Alberta Health Services is working to ensure those most at risk in shelters will be vaccinated in a timely manner. Tomorrow, Council will receive a report that addresses the cost for extending shelter accommodation at Tippinawa until the end of April. This is a short-term reprieve that will provide more time to develop an integrated and coordinated plan for the homeless serving sector. Administration is working with the Government of Alberta, Homeward Trust, and other partner agencies to identify workable bridge solutions that complement our long-term goal of creating permanent, supportive housing for Edmonton's vulnerable population. Administration has established proactive patrols in transit hotspots, with city peace officers and EPS, including their help team and the partnership with Boyle Street Community Services. We have increased the number of contracted security guards for the next 2 months to provide extra oversight and support in hotspots. We're building awareness of the transit text watch service with the city's neighborhood empowerment team, EPS community engagement teams, and students from Center High over the coming weeks. At our last EAC meeting, I introduced administration's other key pandemic priority, and that is our plan for rebuilding vibrancy back into our economy and community. If Edmonton is to exit the pandemic strong and resilient, we need to synchronize the adjustment of our services with the easing of provincial restrictions. The city's recovery plans are distinct from other City of Edmonton strategies, such as the city plan. The actions that we take during the recovery phase will build into our reimagined work and sharpen our continuous improvement focus on service delivery. Recovery work will be complete when public health orders are lifted and no longer relevant. As we approach the one-year anniversary, March 11th, of the declaration of the COVID-19 pandemic, we continue to live and learn from this global crisis. On March 11th, the Canadian Urban Institute will be launching a report entitled COVID 365, an initiative that examines how life in Canadian cities has changed and how we learn and work together to respond to what comes next. Similar to our COVID response and relaunch work, our approach to the recovery plan is informed by several guiding principles we'd like to present to you today. The first is that the principle of safe and equitable. We will take a safe, empathetic, and equitable approach to recovery and the decisions on how services are accessed and who is being served. Evidence-based and strategically informed. We will take our lead from AHS and the Government of Alberta. Our actions are undertaken within the context of the provincial strategy for recovery steps 1 to 4, as well as municipal initiatives and priorities related to public health measures and outcomes. We're going to be methodical and balanced. Our decisions are made by balancing short-term efforts and long-term health and economic impacts. All decisions will be staged thoughtfully in consideration of safety, inclusivity, the GBA plus lens, acceptable risk, and the city's fiscal capacity. We will look for interconnections between relaunch opportunities and other operational dependencies. We are going to take a conditions-based and adaptable approach to recovery. The impacts and effects of all recovery initiatives will be monitored and adjusted based on available information and the best evidence. The recovery process may not be linear, and progress may include a backward or sidestep from time to time based on these conditions being met or not. And finally, relationships and partnerships. Our response will be informed by listening to and learning from citizens, civic organizations, businesses, and city employees. This engagement will occur via elected representatives, senior leaders of administration, and relevant task team leadership. Social equity and diverse representation will be integrated into our approach. These principles will ensure our decisions and actions are transparent, inclusive, and enable the achievement of our long-term strategies. To ensure the effectiveness of our decisions and actions in the recovery phase, we're going to monitor our environment using 3 dimensions. Each dimension is strongly informed by anti-racism and GBA plus lenses. We will monitor the health of Edmontonians by examining usage of support such as pop-up facilities and shelters, by assessing the broad community indicators such as the percent of population vaccinated, the number of hospital admissions, and the number of new cases, and by understanding the status and usage of our recreation services. We will monitor the health of our economy by examining intercity, interprovincial, and international travel volumes through participation levels in elementary, high school, post-secondary, and daycare programs, by the number of visitors to our cultural offerings such as the museum, art gallery, libraries, and key festivals, and by the number of progressive construction projects and startups, and by the signs of mobility within the city such as transit ridership and traffic volumes. And we will monitor bylaw compliance by tracking tickets, issued data, and business license suspensions. We monitor adherence to safety regulations by examining compliance to public health rules. Together, these data points and trends will confirm our recovery progress, and they will be shared with the public on a recovery conditions dashboard that will be available publicly. As mentioned, we'll be taking a conditions-based approach to recovery instead of a time or calendar-based approach. And I have 3 examples of how we will apply conditions to assess when festivals and events are recovered, when the supports for vulnerable populations are in an ongoing status, and finally an example of when we might recommend to Council to repeal the temporary face covering bylaw. I note that these examples are, examples and that the conditions will be monitored by an overall dashboard to plot our progress, support our decision-making, and along with our partners, celebrate success. So when we look at festivals and events, the conditions will include bylaw compliance, provincial regulations in which step we're in the provincial recovery, vaccination percentage, hospital numbers, percentage of new COVID cases, the travel status in, interprovincially, including modes and flights, cultural institution opening, and transit ridership capacity. The second example would be the vulnerable population and shelter support. Conditions to assess these decisions will be based again on bylaw compliance, provincial regulations, the status of indoor social gatherings as an example, the number of pop-up facilities, the number of people accessing shelters, vaccination percentages, hospital rates, percentage of new COVID cases, and the status of these new variants. And for a final example, when to repeal the temporary face covering bylaw. There are many conditions that would need to be in place, and they encompass all the ways we are monitoring our healthy Edmontonians, healthy economy, and the overall status of regulations and compliance. The vaccination of Albertans at the highest risk continues through March, and the pace of progress will depend on the number of doses made available. Our conversations with Alberta Health and AHS have focused on a mass vaccination site and the non-medical operational support the city would provide. We have continued to advise the province that we are ready, willing, and able to assist with a vaccination experience that is accessible and efficient. We are looking at the Expo Centre as a potential site, and our involvement would be focused on supporting the efficient flow of people with appointments. Management of parking lots and lineups are other areas that have been offered in support. In addition, the city can offer enhanced transit support to make the immunization process more convenient and accessible. So thank you very much. We are happy to take your questions, and we're interested to hear your thoughts about our recovery principles in particular, and the concept of being conditions-based and monitoring those conditions. Thank you very much.
Thank you, Mr. Corbould. Quite a few questions stacked up here, starting with Councillor Walters.
Thanks, Mr. Mayor. Thanks, Mr. Corbould. So maybe to start with, I'll ask you, Andre, and also Dr. Sikora about your perspective on the risks of a third wave, considering what we're seeing in Ontario, the variants that are starting to run rampant. Just a minute or so on that, if you wouldn't mind.
Thank you, Councillor. I mean, I would start by, I'll defer to Dr. Sikora on the risks of a third wave. What I can speak to, I think, very confidently is if there is a third wave, this conditions-based approach will not only help us make decisions on recovering and moving out of COVID, but if we have to regress in terms of restrictions or impose other restrictions, this same conditions-based approach is going to help inform us in a scientific and very clear, transparent way when those decisions would be made and could be made based on examples I've provided you in terms of those conditions. And maybe I'll just defer to Dr. Sikora on the first part of the question.
Oh, thank you, and thank you, Councillor Walters, for the question. It is a good statement, and it's a good observation. So what we have seen and what we're seeing right now is almost a plateau from that large peak that we had in November and December. Now that plateau is still a large number of cases in the Edmonton area. So we have continued worry around persistence of spread of COVID-19 in and around our population. And that's, I think the interplay with that is we have an emerging immunization program that will, of course, help prevent spread overall, but we don't have full penetration of that immunization program overall. When we look at something like the R values, and the R values that we've mentioned is perhaps an indicator of continued spread. Well, that downward slope off that peak of December and November had seen R values of 0.78 or 0.8-ish. It's started to creep back up to around 1 or just over 1. So we're in a plateau environment at this point, and that reinforces our need to be ever vigilant around those public measures to help reduce spread and reduce entry into those either business settings, congregate living environments, or those group gathering locations. And that means our risk-based approach, and then flexibility being the name of the game, to be able to inform how we reopen, how we modify what our public actions are based on what the evidence shows is what has to be done. And we certainly have seen that from our partners in the government of Alberta when we moved to a step 2, and they also pushed banquet halls, casinos, and those other locations into a future step 3.
Councillor Walters?
Oh, sorry, I muted.
We've all been
accidentally. Wanted to talk briefly, Mr. Corbo, about these very disturbing incidences of aggressive racism at LRT stations. I know we'll get a chance to talk about this hopefully at some point, but in some conversations with EPS that I've had, there's been some suggestion that this stuff has increased over the period of COVID. I don't know if we could directly connect these things to COVID incidences, but very upsetting and certainly adding way more anxiety to people from the Islamic community on top of being worried about the pandemic. So I wanted you to maybe comment on what we're able to do and what we are doing in terms of security around at LRT stations where many of these events are taking place.
Yeah, thank you very much, Councillor. I mean, it is very upsetting and very disappointing to see any of these incidents happen, and I really feel for the folks who have had to endure them. And so one of the things we have done is we've worked with EPS on all of our SOPs for helping folks at LRT stations. Some of that was based on earlier incidents where we've wanted to treat vulnerable people in a different way, but I think some of those SOPs will also help from a security perspective in terms of aiding anybody who needs aid at a transit station. Secondly, as I mentioned in my briefing, we have upped security in a lot of these locations and locations where these events have happened, and so we think that enhanced security will be helpful in terms of detecting and deterring. And so that has been done with the desire to get a different outcome. And finally, I think it may be worthy of some important discussions within the community about this. And I'm glad you're bringing it up because it prompts just another discussion. I think the community of Edmonton has to talk about it and talk about these events and not have them brushed under the table so that people can understand what's happening and be equally, I would say, offended with some of the things that are happening.
Okay, thank you for that for now. Thanks, Mr. Mayor.
Thank you, Councillor Nash.
Thank you, Mr. Mayor, and thank you for the information today. I'll start with Dr. Sikora. I just wanted to get your take in response to Councillor Walters' questions and more generally, you brought up as an example the R value, which, and I know all of this changes and we constantly have to adjust, but I'm just curious because back when a number of restrictions came in December, I remember the Premier clearly stating that the R value is one of the major factors they were monitoring. And then when the stage reopening plan came in, there wasn't so much a reference to that, but it was primarily related to hospitalizations. And as of the last update, we're now at 1.16 in that R value in the Edmonton zone, which I think was about where we were in November, December. So I wouldn't mind your take because it doesn't appear that is as big of a factor anymore as the number of hospitalizations. And can you provide me some insight as to sort of the changing nature of what measures we're using to help inform those decisions?
That it's a good question, Councillor Knack. The decisions in the Government of Alberta level are being done at the Government of Alberta, so I'm not at those tables to help inform those decisions. From what we've observed is a willingness and a want to look at healthcare system capacity, hence the focus on hospitalizations as one of those prime drivers or one of those prime indicators. Our values are, of course, dependent on of course, the number of cases that you have in your population at a particular point in time. Our number of active cases right now is quite high. It's the same level as we had around the November 8 or 9, when those cases were rapidly increasing. I know and strongly suspect that the Government of Alberta is looking at many other indicators as well, our value being one of them. Really, what is the shape of our curve? Are we plateauing? Are we decreasing? Are we increasing? We're monitoring actively variants as something of importance, given their increased probability to transmit from person to person. And that was another condition that wasn't present back in that November time period. So there are a number of different factors that I suspect are being looked at, but hospitalization really as an indicator of what is the healthcare system capacity and strain is one of those primary ones.
Okay, great. Thank you. That's a great additional insight. Mr. Corbould, I wanted to ask about, in your presentation, you talked about our offer to the provincial government to support them with supporting those who are in line to get vaccinations. Fortunately, our weather right now is a lot better than it was when I think the first couple of days when it rolled out. But I do remember getting correspondence, and I've had people who have personally gone out and still find that those lines can be quite long, and without seating available for seniors, without different things like that. And so I'm wondering, do we have to, I guess, wait for them to say, please help us, or are there maybe some things we can do to try to just provide some additional support? Weather isn't the bigger issue right now, but it is a matter of comfort. I think the nurses are supposed to be able to deliver, or at least the target is supposed to be able to deliver a vaccine within either 10 or 15 minute interval. It's one of the two, I can't remember, but it takes a lot longer based on what I've heard from some of those who are administering vaccines, which is what's generating these long lines. So I'm wondering, can we help them without the province saying, please help us?
Yes, Councillor, we certainly can help them, and we don't need to wait. Certainly to run an entire site like the expo that we've been talking about, they need to decide that they're going to do vaccinations there. I think, as always with these new things, there's been a couple of adjustments. Part of the protocol when people go to these facilities, they are recommending that they stay in their vehicles before it's much closer time to their time of appointment, because of course they're being done by appointment as well. But we're going to work with the province and see where we can help and offer assistance. And some of it is us knowing exactly where all these places are going to happen, and we have a better clarity on that. I think the other thing that's going to help out with this particular issue is that I understand, and I think it's approximately on the 8th of March, there will be a move to pharmacies to conduct some of the vaccinations. So that's going to spread out the population, the lineups to a bunch of different venues, and I think that will help reduce it. But certainly in the meantime, we'll see what we can do, and if there's anything we can do to help in terms of making it more comfortable, we will do what we can.
Yeah, and I didn't even know if it's like benches that we might have extra ones and other things like that, but I'm out of time. I'll come around for a second round. Thank you.
Thank you. Councillor Paquette.
Yeah, thank you. Yeah, I think that last bit from Councillor Knack really points to the fact that we sort of have a car-centric way of thinking when a lot of seniors have basically opted not to drive anymore, or they can't drive anymore. So waiting in a car doesn't really make sense because they have no car to wait in. So do we need anything for, does administration need any direction to be a little more proactive in ensuring that seniors are okay while they're waiting in line?
I don't believe we need any more direction, Councillor. I think we can be more proactive, and we'll do that over the coming days.
That's great. Thank you. Okay, so I want to go back to sort of that, feeling of security in transit and things like that, with less people, going out into public, we sort of lose that natural surveillance aspect of things. So, and the fact that because we're virtual, it's a little bit harder to have these community conversations. So, what can we be doing to help the public know that things are happening? Can we tell them what is happening in order to increase this level of safety? And, with that in mind, I think that I should just also state that working with a few other councillors like Councillor Hamilton and Councillor Esslinger and Councillor Walters, we're sort of hammering away at a motion to that effect as well. But perhaps there's things that can be done before that.
Yes, Councillor, I would say we have to, it's like I mentioned before, we have to talk about these events. We have to tell Edmontonians what's happening to other citizens. And I think the more we talk about it, the better. And I agree with you, there's less people wandering around watching these things, and that can provide space for some activities to happen. And if we can't be there all the time, then we can talk about it. And we can do that on our websites. We can do that in our communications with elected officials and ourselves. And I think there's been some very appropriate statements with some of the recent incidents for sure.
Sure. I guess I'm kind of thinking about the fact that folks would want to know what the practical next things are. Folks are kind of aware of these things already. They would just want to know what's going on next. So I'll just, if we have anything to give people, I think it's probably important that we put that out there rather than just sort of have a conversation about racism.
Our communications folks, Councillor, are working alongside our transit colleagues to ensure that we've got messaging and tactics in play that will enable us to reach the broader community with messages of what to do if you witness, reassurance about the fact that we are taking security issues very seriously. There is thought being given currently to an entire body of communications work on this topic.
Okay. And my other question, now just hopping over a little bit, but is there an element of mental health or addictions in our communities that we know is increasing, that is impacting crime and safety? I think we know that this is the fact, but do we have an advocacy plan with the province in order to help us to mitigate some of those addictions issues? Because obviously, just say no isn't really a strategy.
I would say that we are certainly talking to the province a lot about the long-term mental health concerns that are going to be result from COVID. I think it needs to be a fundamental and probably the longest term part of our recovery plan in the city. And it's not just talking about it, it's seeing what we can do in terms of actions. I would say that needs to be a very fundamental part of the recovery plan, which is why I think we've alluded to it in our principles in terms of recovery and making sure we're looking out for the welfare of people. But I don't think we've done all of that yet, Councillor, and I think we have a lot more work to do as we move towards recovery.
Okay, thank you. And for Dr. Sikora, just a quick question. Looking at other jurisdictions, seeing what their experience is, even understanding that we have a vaccine rollout, what do we anticipate is going to happen as we start opening things up more? Do we anticipate that there will be an increase in transmissions and an increase in deaths due to transmissions?
Oh, that's a good question, Councillor Paquette. Sorry, I'm getting a bit of a feedback here. When we look at a reopening strategy, we are trying to balance those risks of transmission as it relates to the increased contacts in between individuals with, in the face of an immunization program, the opportunity for more and more Albertans and Edmontonians to be protected against COVID-19. So they're acting against one another. So as we immunize in our first phase of immunization, that service was provided to the most vulnerable from bad outcomes. So those in long-term care, congregate care settings, and then the workers and staff that take care of them. That was done quite intentionally. Now, as we expand into the later phases, so later phase 1 and then phase 2 and phase 3, that'll expand out more and more to other Albertans, those that work in service sectors, the general population, our age groups, and we've seen that expansion into that over 75 most recently. As the product availability and product delivery in the Alberta context allows us to expand more and more that immunization campaign, we'll have a larger and larger fraction of Albertans and Edmontonians that are protected from having a bad outcome from COVID-19. So that protected level of that fraction will increase, and that's a good thing overall. As we reopen, there is that countered opportunity for increased transmission events, the increased probabilities that people wouldn't necessarily be wearing their face mask as much when the bylaws and the legislation changes. The restrictions and precautions that we've all very come accustomed to in stores and in our schools around hand washing, physical distancing, will mean that there is possibility for increased transmission, absolutely. So it does mean that we have to be ever vigilant around monitoring for COVID, so testing when you're symptomatic, staying home when you're sick, and those are things that I certainly hope will persist when all of this is over and we're fully reopened. Because those are things that help not just for COVID-19, but for other illnesses, for influenza, for gastrointestinal illness, other respiratory pathogens as well. So we'll continue to, I think, reopen gradually based on what the numbers show. And at present, we've seen a readjustment from our provincial partners around what that reopening looks like by taking out some big things out of step 2 and putting them into step 3. Because I believe of that worry of increased transmission in those areas. So we may see an increase. I certainly hope not. I certainly hope that as we have a larger and larger fraction of our population that's protected with vaccine, and that as we slowly reopen, our case counts will continue to go down generally. And it's going to take a long time to be able to do that. And I've gone overtime. I'm sorry.
Oh, it's okay. My 9 minutes are almost up.
Dr. Sikora, there are no restrictions on the sharing of your knowledge with us here. We do appreciate. Yeah. Councillor Henderson is next.
Well, just maybe to follow up on a couple of things really quickly. That one of the things that I'm worrying about on the increase in the racist incidents is that it seems to me, and this is pure hypothesis, but I'm wondering if anybody's done any work on this, is, that in times when people are stressed, we saw this happen in the last century, racism tends to rise because they go looking for scapegoats, and the scapegoat is always the other. And it worries me that that's what may be happening right now. I'm guessing social media does not help that. It actually speeds it up. But I'm wondering if there's any work that's been done on that, because it seems to me, we have our work trying to get rid of racism, period, that we need to keep on going. But I worry a little bit that something else is even worse at play here, and whether or not we have any understanding of that and how that may inform how we respond.
I agree with you, Councillor, and we haven't done any work on that, and we can maybe undertake to get some more research. I can only assume that there's been, unfortunately, the need to do much of that work, and we can undertake to dive into the research and perhaps provide a better answer at the next discussion.
I only ask because I think
certainly our the committee that Council stood up last year, the Anti-Racism Committee. Certainly are weighing in. We're working with them more than we ever have in the past, so they're very, very active in trying to deal with the questions that you're raising as well. So they're doing a fair bit of work on this, exactly that question.
I just worry that there's something very specific happening here, and if we think of it as a general thing, that we may miss an answer. That's all. So, and then another question arose from some of the other questions I've been listening to. In terms of getting seniors in particular to their appointments, how is DATS responding to that? Because knowing all the things we have around DATS and timing, it strikes me that if we haven't already seen that raising its head, it's probably coming.
Yeah, thank you, Councillor. I will defer to Mr. Seabrook if he's here just to chat a bit about DATS perhaps. But, and I did want to just clarify though that we are in the lines we saw, we are seeing a lot of people bringing seniors to get vaccinated. So I was not trying to indicate that, you know, they couldn't all be driven, but there's a lot of people driving their parents.
We all have seniors we're trying to figure this out for, so I know that the various different permutations of this story.
But Mr. Seabrook, do you have anything to add on the DATS response, please?
Councillor Henderson, we have been trying to be as flexible as we can to meet the changing demands under the pandemic. And I'm going to ask Ms. Houghton McDonald to just provide a little bit more insight on terms of some of the specifics that we've been actioning over the course of the pandemic and most recently.
Yeah, thanks, Gordon. I think specific to your question, Councillor, we certainly have capacity in DADS. So demand has been down quite a bit. And I think for those seniors that are already registered, it would be very easy to be able to book trips and ensure that they get the support they need to get to that appointment.
Yeah, I just, you know, clearly getting them there early is going to be problematic in a way we wouldn't usually worry about. So that's why, and you know, knowing our tolerances around that, I just wondered if we were going to have to respond in a slightly different way for anybody trying to do this. Great, thanks. Dr. Sikora, I'm interested, you know, seeing that the new case line seems to have flattened. If anything's bouncing back up a little bit. Do we have any sense of where it's happening right now, or is it too generic for that information to be useful?
We do look at that. So ultimately, it's not tied to any one location. It's a series of locations. So it's more general.
Or even kinds of places
unfortunately.
Where, yeah. I mean,
we do follow up all workplaces. And so we do work with operators once we identify cases to ensure that they have the appropriate measures in place. But, you know, what we found is that our businesses have a great deal of skill and awareness of what the responsibilities are, and we've been exceptionally happy with how they've responded.
Yeah, I only asked the question because if there are patterns, if that helps inform what, you know, is safer and what is less safe in terms of where we're seeing, you know, that, I mean, understanding it's flat, it's not going down. If there's any kind of pattern there that can help us inform, you know, what we may need to still keep on focusing on in terms of kinds of activities. But if there's no pattern, that's fine. I just was curious to know if there was anything.
Yeah, nothing that jumps out, unfortunately.
Okay, great, thanks. I'm out of time. I have to come around for another round. Great, thank you.
Thank you. Councillor Essing.
Thank you. First of all, I wanted to say that I appreciated the principles of Recover, safe and equitable and adaptable. I think we've learned nothing else. We need to be adaptable throughout this process. So I too am worried about the amount of harassment and racism, particularly for women. And I know some of the women have taken self-defense classes, you know, and that's a great thing, but it's sad that we have to get there. So I'm wondering, as we're rolling out our response, are we also looking at some of the work that's done on bystander training, some of the work that's done through the UN Safe Cities that talked about that, if we're looking at in our communications or how to get that out there?
I'll just see if Ms. Owen wants to.
I'll happily weigh in on this one. Certainly, in order to be more intentional and focused on such a sensitive issue, we're happy to take advice about where we should look for wisdom. So those are great suggestions. Thank you.
I just happened to get an invite to discussion on the world level about increased harassment and violence against women. So we're not the only ones facing it, but I think we need to be responsive as best we can. And so I was thinking about when we first went into the pandemic, communication used to give us these little things we could put out on social media, which we haven't had in a while. But I'm wondering if we could do it on helping with the bystander training. I'm just throwing it out there. Might be helpful.
Yeah, we did reconfigure our council services division somewhat. So noted that you haven't been getting that same support. We can absolutely furnish the councillors with something that they can use in their own distribution networks.
I always think consistent communication is helpful. My other questions are around, we talked a little bit about the vaccinations, and it's great that we're volunteering to help, but my fear as we go forward, and it's going to be in pharmacies, we're going to have some parking lot issues throughout the city, but it doesn't sound like we're at the table on some of those conversations yet. Is that true?
I'm going to ask Jennifer Cluth to respond to this because she is at the table with the province on a pretty routine basis.
Thank you, Councillor. The conversations right now with the province and Alberta Health Services are currently focused on if there's a requirement for a surge site, which might be something like an expo. But the points that we're hearing today on as the rollout happens through pharmacies, through Alberta Health Services sites, parking lot supports, and just to make the experience as best as possible, we are already starting to take away some ways that we can do that. We supported Candy Cane Lane with parking and navigation. We might see something like that come back to council as how we're supporting these vaccine sites.
Wonderful, and I think we'd like to get everybody vaccinated, so the more help we can be, is the better we're off. My other question is, I just wanted to clarify, where are our frontline workers, police and fire, in the vaccination schedule? Are they still coming, or because we want to make sure our frontline workers are taken care of too?
Yes, Councillor, they have not been identified separately in the next phase of vaccinations. And there's continuing dialogue, continuing advocacy on that. But one of the challenges on this is that when you calculate all the people that are on the front line in the population, whether it's working at grocery stores, working more frontline, more stressful incidents such as fire, but when you start calculating the population, it very quickly gets up to about 80% of the population that are in some way on the front line. So we're continuing to work and have a dialogue with the province on where people should be, and make sure that that's being taken into account. I am satisfied that these decisions are not being made politically in any way. They're being made by health experts, and I think the health experts are weighing who is most susceptible by their work and by what they do of potentially getting COVID-19, as well as what ramifications, if they get COVID-19, does it mean to them in terms of health, which is why I think you're seeing such a focus on the vulnerable and seniors. So it's a continuing conversation, but they have not been separated out from the rest of the population in the next phase. And I don't know if Dr. Sikora wants to add anything.
No, I think just to reinforce that those conversations are ongoing, and there's still yet a lot of work to do around that.
All right, my time's up. Thank you.
Sorry. Next is Councillor Katarina.
Thank you, Mr. Mayor, and thanks for the information today. Clarification, Mr. Corbo, the first page of your presentation on the stages and the headers are hospitalization. First, is that ours or is that the province's? Just clarify that for me.
Sorry, Councillor, do you mean the hospitalization rates?
Right, yeah, that when it reaches X amount, we'd look at the next stage. So that's our headers on there are or is that the province of Alberta Health?
Yeah, the province uses hospitalization rates as an indicator, and so do we. So we're both using it. We're obviously focused in on our zone and Edmonton, but it's a common indicator that both the province and the city will use in recovery.
Okay, but as has been stated, that's not the only indicator, because that when you see the header there, below a certain amount of hospitalizations, you move on to the next step. That's not what we're seeing. Because from that page there, we should be in stage 3 at this point, but yet we haven't implemented all of stage 3. Is that correct, Mr. Corbo?
Yes, that's correct, and that's why it's not just one indicator; it's a group of indicators that inform the decision.
Yeah. Okay. So just to be clear in my own mind that that's not exhaustive. That once that hospitalization is either met or not met, that we either go up or go down. There's other things that have to be considered. So, Mr. Smythe, with the rec centers and the scheduling, that's fine in that, and exercising and those sorts of things. That's great. Why have aquatics not been part of any of these discussions? Is there something about aquatics that either we don't know how to handle? There been discussion on it? For example, a lane swim where one person in a pool in one lane at a time, that to me sounds pretty reasonable, unless there's something about aquatics or water that transmits
certainly,
more
Councillor,
seriously than anything else. Just give me some brief.
The current requirement is that the person in the water has to be supervised by a coach or someone to that effect. So if they're doing that, that's reasonable. But in terms of the public allowing in for a lane swim, as you say, it is not within the current what's approved. I don't know if Dr. Sikora has any more details about aquatics specifically. And we're certainly contacting all of our colleagues around the region and the province to understand that better. But it's a good point. I don't know, Dr. Sikora, is there any specifics about aquatics that you could weigh in on?
Is there a rationale for it? I'm thinking as well too. I mean, now we're getting into spring and summer, and soon it won't be just the indoor facilities; it'll be the outdoor facilities. And I think we probably should have a good rationale of why we're either omitting that use of our services for a specific reason. And there might be a really good reason. I just haven't heard one yet on what that could be. So, Dr. Sikora, maybe just in a little brief, do you have any information on why aquatics is seen as so dangerous?
So it was a bit of a challenge, and I think when the original orders and the direction and the guidance for aquatic environments came out, it was also intended to encompass not just the small facilities that might be, for instance, within a hotel environment, but the large facilities that many of our municipalities have. Our municipalities, and this is across Alberta, are working together with our partners at Alberta Health to describe how best aquatic environments can be still within guidelines, or if there are exemptions that are required to be able to be safe.
Okay, so realistically, we're still studying it, and we don't have any pertinent information one way or the other. It's still a study going on. So that's fine, Dr. Sikora. That's all I needed for that. And EPS is on the line. Can I ask, is there any information that you can share about the incidences at the convention center? The 2 arrests, was it something to do with the facility, or was it just a coincidence that it was exercised where it was?
Yes, sir. It's Kevin Brzezinski here. So I can share some details with you in relation to the event that happened at the ECC yesterday. And generally speaking, there was a stabbing that had occurred at the central LRT station yesterday afternoon, where a male was seriously injured and taken to hospital. it was learned that the suspect in the stabbing was at the ECC. So our members had responded to that location and spoke to the shelter staff, and we then learned that the male was indeed inside. So as we went to approach the male, he began waving his arms. He was very combative and actually indicated that he wanted police to shoot him. So as we started to approach the male, a crowd gathered from within the ECC and started to surround our members. Lots of things were thrown at our members. Inevitably, this person was apprehended and arrested and was charged.
Thank you for that. Thank you.
Thank you. Councillor Zadok is still on the first round. Go ahead.
Thank you. With gyms opening up and the ability for some individuals to work out per the low intensity and definition and avoiding high intensity, just given that people have different definitions about intensity of workouts, is there any information provided about weight room facilities if those are going to be open, given that everyone has a different definition of what high and low intensity is?
Councillor, that'll largely fall on the shoulders of our supervisors in our rec centers to monitor and assess different people's levels of fitness, basically, to ensure that they're not overexerting themselves. Mr. Jevney's on the call. Roger, do you want to jump in?
Yeah, Councillor, we will be opening up the strength training portions of the facilities, and we'll have signage about what we think low intensity and high intensity is, and you should not be out of breath. You should be able to carry on a normal conversation. And if you're working out harder than that, that's not permitted under the guidelines.
Okay, I think that sounds reasonable, and I just wanted clarity because it was fairly ambiguous. So no spotters if you're weightlifting and the like, the examples you mentioned. Thank you for that. No more questions.
Councillor Banga.
Thank you. I suppose EPS is still on the line, and got a question for those folks. I know there has been an increase in the number of incidents, or at least number of reports in relation to racially motivated attacks on unknown to unknown person. Is this an isolated category, or is it generally from a unknown person to unknown person? Is there an increase in the number of incidents?
Councillor Bang, I don't have the specific details with respect to the hate incidents that have taken place. We have a pool of individuals, some with addiction issues, some with mental health issues, that have been responsible, but I don't have the specific stats for you.
Okay. From time to time, reading the papers or emails that we get, it says, basically implicating that EPS did not do much about certain incident. I'm not going to pinpoint the incident, but how does EPS tries to combat that kind of allegation or allegations?
Yeah, Councillor Banga, I think, as you're probably aware, being a police officer before, we have to meet a certain threshold in order for a hate incident to be a hate crime. And you're kind of restricted within the criminal code in terms of arresting and charging someone for a hate crime. Unfortunately, in the city, we have too many incidents that are simply incidents that don't meet that threshold for a criminal charge. And it's that balance of investigating these and educating the public in that regard.
Okay, is there any way that our councillors' offices or our mayor's office can somehow get the word out, which can also support you through our social media platforms?
Absolutely. We have it on, we've shared a lot of this with the community as well. And we actually, as of today, we did a Facebook Live telecast kind of outlining the same information. So I can follow up and certainly provide you with some detail in terms of an incident versus a crime.
Okay.
And Councillor Benga, reiterating my reply to Councillor Esslinger, we can amplify messaging from EPS about the tolerance, the lack of tolerance towards hate crimes.
Okay. Yeah. No, I was gonna ask you the same question anyway. That we need some, I guess, guidance from your department, how we could be of any assistance to you folks, so that it's not one person's or one department's job, it's everybody's job. And
thank you.
A couple more questions here. For the use of provincial, I guess, an effort to help the government, their AHS, about Expo Center there. Are we? I know some questions have been asked already. However, I mean, this is a big space there. Where I know there is a space for people, there's space for parking, and I don't know if we could even talk about providing free parking and whatnot. And then we can also use those big boards to for people who are actually choosing to sit in their cars to in their cars to wait for their turn. And I don't know if we have ever pitched that kind of information to AHS.
Yes, we have, Councillor, and that's why that site is the predominant site that they would be using if indeed they feel they need that additional service.
Thank you. My time is done.
Thank you. Councillor Knack.
Thank you, Mr. Mayor. A few more quick questions, and this one I got a few days ago. Just some folks who were expressing concern about being able to easily access the ride transit program, and this might not be as big of a deal with the ability to have the recreation spaces reopening, but they have found it was challenging without those spaces being open to easily get to a location where they could then get their pass. So again, maybe this won't be an issue going through the rest of the month. Things might get better and they'll have a space, but I just wanted to flag it and see if that's something that we're aware of or heard about, because I've had it now come up from a few different people who have felt it was just a little challenging for them to get what they needed.
Thank you, Councillor Knack. It's Carrie Houghton-McDonald from ETS. Yes, we are aware. We've been trying to accommodate people on an individual basis in this interim period. To reduce the risk of COVID transmission, we moved to a lot of digital solutions, but recognize that may not work for every single person. So just encourage them to reach out to us and we can work together during this period to make sure they get what they need.
Great, thank you for that. Appreciate it. The last question I have, and I know I think we're still in fake spring, not real spring. This is the spring before the winter, before the spring again. But it does cause me to start thinking about the availability for space. People are going to be outdoors more and more. There was a bylaw that recently came forward to Urban Planning Committee that will come to council next week around being able to have those shared spaces, particularly for those who are on foot. And so I guess I'm wondering, last year we had a number of locations that were more focused in and around the core. I'm curious if we've started to think about communities outside the core who might have access to those spaces, have needs for people who are going to be traveling by foot to stay safe. And this could be addressing two issues, both, again, the physical distancing requirements, but also as we get ready to roll out the street labs approach, if there are opportunities to look at that in these other communities?
Oh, Councillor Knack, it's Gord Sebrick. We definitely have been putting together our plan for the action on the both the street labs as well as the connection into the shared streets and reintroducing those again this year. We do have a plan for moving forward on them and really tying it into as soon as possible based on weather conditions. I'm going to ask Ms. Massini, she's on the call, and she can provide a little bit more detail in terms of some of the specifics of the rollout and what other areas we'd be potentially looking at this year.
Good afternoon, everyone. We are looking at bringing forward a core network of shared streets and lane closures to support physical distancing. On top of what we did in 2020, we learned some lessons and we engaged with communities in the meantime. And what we are looking to do for 2021 is potentially bring forward an expanded program where communities could come forward with requests. And if those requests meet the criteria around a shared street, we would proceed in that regard. We also recognize that the safe mobility section of the city will be coming forward with street labs. So we don't want to confuse the two while shared streets and lane closures have a very tactical response with respect to physical distancing. We want to make sure that we're addressing those areas where we might see those increases in congestion.
Okay, great. So the hope would be that if there is a community that says, hey, we've talked about it as a neighborhood, we've got a lot of communities about to go through their AGMs in the spring, not all of them do, but some of them do, and they say, listen, we'd love to see this stretch of roadway put forward with a shared street model for the benefit of our neighbors. Do we have the capacity to support that? Do we have the infrastructure required? I mean, I know it's not really intensive. It's a couple of pylons and a sign, but it might be seen to be a bigger deal than it actually is. But do you have the necessary equipment to do that if a community says, hey, we'd like this?
We do, and we explored it based on relative to the criteria that we had established previously: high density, high demand, lack of green spaces, like relative to a lot of our programs that we are delivering in 2021. We do have the capacity to support those communities as they come forward. Again, recognizing that in some cases what we saw. Perhaps a positive benefit of the shared street, really enhancing the livability of a community and maybe trying to address other issues. We feel that with the Safe Mobility Program, we will be able to address some of those other issues that don't necessarily align with providing that safe space for physical distancing. So we're prepared to address this year.
And Councillor, the other thing we'll also look at making sure is that we're connected in with Ms. Owen's team to make sure that citizens know what's available and what the program looks like. So we'll make sure that there is a proper communications plan to accompany that.
Perfect. Thank you. I'm out of time. Appreciate it.
Councillor Hand.
Yeah, maybe first, I'm interested in the principles, Mr. Corwell. The one that I because it's such a interpretable word, which always worries me a little bit, because I think I can understand what it is and it may mean something different for everybody else, is the word balanced. And that one makes me a little bit nervous, and I just wouldn't mind hearing what we mean by that.
Yeah, thanks, Councillor. I mean, from my perspective, what balanced means is that we're balancing everything. We're balancing short-term considerations with long-term considerations. We're balancing the health. And we're balancing the economic vibrancy and health. We're balancing...
And maybe that's why I flag it, because the reason, and it's not that we shouldn't be asking those questions, I'm not suggesting, but it does seem to me that you cannot answer that question of balance unless you have agreement on what you're trying to achieve. And I think, I think we've got ourselves into trouble in the last year because I think there's been great disagreement about how you balance those last two questions. I think you only have to look at some of the U.S. states to understand that their interpretation of balance and got them into much bigger trouble. So that's why I'm a little bit nervous about it, and I wanted to just flag it because I think it's more complicated than we think it is, and it assumes that we're all on the same page about what we're trying to achieve and how how certain things should be weighted.
And I think it's incredibly complicated, like you mentioned. Yeah. And I would point to the fact that the first principle is safe.
Yeah.
And so that is a principle that I think has to drive everything. And there can be balance within safety first, but that's what I would point to.
Yeah.
And one of the reasons we listed that, safe and equitable as our fundamental first principle.
Okay, I just thought I should flag it. I understand what we're trying to achieve, but it seems to me as a principle, it may be a slightly dangerous one because it's way more complex than it sounds. So I leave that with you, but that, if you're looking for a response, everything else was crystal clear to me. That one seems to me might need to be teased out a bit. So,
yeah. Thank you. We'll take that away.
Just as a kind of interesting heads up, having spent the last couple of weeks being able to go to a couple of the winter festivals that were given the green light to go ahead, and I think actually have shown that it's possible to do this safely. They're very different from the way they've been done in the past. I know Silver Skate was mobbed, which is probably something we need to understand. I think in retrospect, putting some kind of cap on the number of people that could go down there might have given them some comfort. The Flying Canoe has done that, so if you try to book a spot to go in, you can't get one anymore. So there's a huge pent-up demand, which is not a huge surprise. But I think there's some interesting, as the summer comes, I suspect we're going to bump into more of those kind of places where people are just so hungry right now to go out. So these are fun success stories, and I think they've shown that there's a way to do them very safely. But just as something we're going to have to keep an eye on, because I suspect it'll become even more the case as we go into the summer months. So,
yeah, very much so, Councillor. And it's really one of the reasons I wanted to use festivals as one of the examples I highlighted, and how we're going to use criteria and science to guide those decisions.
Yeah, and I think clearly, I think if I've learned anything from the winter ones, being able to make it possible for them to do something had huge value. It took them, they started back in September, I think they asked. And took a risk because they knew that they were going ahead with plans that might have to be shut down at the last minute. So, but I think it's been a huge success story, and I think so far there has not been any health risks that I've seen having gone to all of them. So I think probably as we go into the summer, the farther out we can look on that and start working with groups, the better. I'm curious if the other one that popped to mind that I thought was interesting that came up from the last set of questions is, do we have any numbers on where traffic is at right now? It still feels to me anecdotally that it's significantly lower. I mean, I used to avoid rush hour because you couldn't go anywhere, and now it's just a non-issue. And how much that, how we can monitor that in terms of the questions I think that were being asked by Councillor Knack in terms of what we may be able to do given what traffic may stay down out in the coming summer and understanding that. Have we been monitoring that?
So, Councillor, Ms. Massini will provide a little bit more detail, but certainly I think one of the things we saw from last year was, the ebbs and flows of traffic in relation to the pandemic and the lockdown. So it's given us an opportunity to be in a better position to anticipate what we can expect. So I'll ask Olga just to put a little bit more detail into that.
It just feels like we still have significantly more capacity than we've had in the past, and that may help us, if we can understand that, it may help us make decisions for this summer. Ms. Massini? Yep.
Yeah, you bet. Thank you. So overall, if we look at it in terms of average traffic volume, in the city, we're looking at a 19% reduction, which doesn't seem like a lot, but if we start looking at specific networks differently, we start to see some disparity. So just as an example, travel volume into the downtown is depressed, somewhere around 30% on average. We see upticks around, major shopping centers. Those might see higher traffic volumes, but not meeting what we were at pre-pandemic. Of course, a lot of that data that we're using is informing a lot of the decisions, in particular around shared streets. Also considering that we're looking at the network a little bit differently, just on the heels of the residential speed reductions as well. So definitely a lot of these measurements are informing a lot of our decisions.
Great, thanks. I'm out of time. Thank you.
Thank you. Councillor.
Thanks, Mr. Mayor. So, Dr. Sikora, just one more question for you. And sorry, I had to step away for a couple minutes, so if someone asks this, you can just tell me that you've already answered this. But I noticed that BC and Ontario have also elevated the homeless community in terms of getting the vaccine due to a couple reasons that I could ascertain. One being that they are at higher risk over 50, and two, the risk of spread that continues to be at play within that community. So is there some thinking about that here at AHS about shifting up people who are experiencing homelessness into a higher tier and to get their vaccinations earlier?
No, and I think it is a shared worry amongst us within the Alberta Health Services environment. Those immunization sequencing decisions are being made at Government of Alberta, and we've certainly made our concerns known, as has our shelter communities around the sequencing and the importance of prioritizing both our off-reserve Indigenous population, but also our inner city population that are unstably housed.
So that's being considered, I guess, is what I would take from that answer.
Yeah, so they have heard those concerns, and I suspect those are part of the discussions that are ongoing at that government level.
Okay, thanks for now. That's all I had.
Councillor Henderson?
I think that was from before, maybe I'll ask a quick question still. Just to follow up on where I was going before, I'm wondering in terms of the traffic, if the peaks have changed, because the reason if we've measured that, because it strikes me that a lot of our traffic system and the capacity of our traffic system is designed to deal with peaks, and it seems to me, or have they just shifted and changed? Do we have peaks at different times of day now?
Councillor, I think there have been a number of different shifts. As Ms. Massini indicated, we've seen a big decrease in some of the traffic volumes, in particular into the downtown. One of the tools that we do have available is Google, and it certainly does provide a lot of relevant information in a real-time format. So we do have a lot of tools to monitor where those peaks are and where they're shifting. And as we see that, it gives us the opportunity not only to adjust timings if necessary, but it also provides us with that information in regards to where there is potential for using the space differently for things like shared streets. Olga, did you have anything else you wanted to add to that?
I think the only one thing that I would add to address the councillor's question on if we've seen the peaks change or look differently, absolutely yes. While the AM peak is a lot quieter and does not represent near normal, what we have seen, we've seen an extended PM peak, so the afternoon peak actually doesn't quite spike to where it typically did, but it starts a little earlier and extends into the dinner time. But yeah, so we have seen the peaks change.
Great, thanks.
Councillor Paquette?
Yeah, thank you. I just want to follow up with Councillor Walters' line of questioning about vaccine rollouts. I'm just wondering if we get some insight into the thinking process about how the province is making determinations about who to vaccinate first. And because it's just very confusing about why perhaps the most vulnerable population in our province is not on that list.
And again, those decisions are made at the Government of Alberta level. So they did prioritize in terms of the long-term care, continuing care population who are at most risk of having bad outcomes related to COVID-19, and the populations of the workers that are taking care of them. So that was the phase one. And then as Mr. Corbould has identified, they are taking that health-based approach of risk. So if we look at the groups, the elderly age group, age 75 and over, and then phase 2, age 65 to 74, our First Nations, Métis, Inuit and Métis people, age 50 and over, no matter where they live, staff and residents and licensed supportive living, not included otherwise in phase 1. So again, we're not part of those ongoing discussions, Councillor, but it does appear, at least from the phased approach, they are taking that into consideration, which groups would have the worst outcomes, namely hospitalization and death as a result of having a COVID-19 infection.
And I would just add, Councillor, that individuals in congregated living settings like shelters are included, and I singled out and identified in the phase 2 vaccination rollout as an early piece. So
yeah. Okay. And now shifting gears a little bit, touched on it really quickly, but we know that usage of things like methamphetamines is rising, and so from a health standpoint, is there maybe more advice being given to the province about how to handle that? Because this is a direct result in many ways of economic downturn, pandemic, and all those things aggregating. So we know that without some sort of safe consumption area, this just happens on our LRT or on the train or in the public, and we can see that it's actually starting to expand and increase as a problem. And so is there any advice being given from a health perspective to the province on how to start mitigating this and reversing the trend?
So over the course of the pandemic, sorry, I'm still getting a bit of feedback there. Over the course of the pandemic, we have seen a rather stark increase in the number of opiate overdose-related fatalities, which is exceptionally sad. An approach undertaken to help address that is part of what we collectively are attempting to do. And as we've described in many of our opiate-related updates to Council, there is a multi-layered drug strategy. Some of that is related to treatment spaces. Some of that is related to prevention. Some of that is related to enforcement activities, but also related to harm reduction activities. Harm reduction services are continuing within the City of Edmonton proper. And we have seen an expansion in the number of drug treatment spaces, of availability, of course, supported by our partners at the province of Alberta. So it is an area of ongoing work, but what we have also seen during the pandemic is really previous things that we've discussed here today is insults to really those basic social determinants of health. We've seen impact to our income, impact to our education system, impact to our housing infrastructure, to our work infrastructure, and those all have downstream effects in terms of how we function as a society, how our collective mental health is, so that there does have to be a lot more work undertaken to help alleviate that, help bring us into a place of recovery as a healthy city, as a healthy community. So there's going to be lots of work that all of us will collectively have to do in the upcoming months to years.
Understood, and thank you.
Thank you. Any other questions? Need a motion then to receive for information.
So moved.
Thank you, Councillor Banga. Please vote.
Would it be possible to speak to this really quickly before we get the results of the vote?
I didn't give an opportunity for speaking, so that's fair. So we won't declare the vote then. We'll pull that back. speaking to it. We'll open a speakers list. Councillor Paquette.
Yeah, and I apologize. It's just, first of all, I wanted to give kudos to administration for bringing forward an actual, a plan that we can look at, that the public can look at. I think that gives a lot of comfort and helps people see that there is some direction here and a pathway. So kudos for that. Thank you. It's what we've been asking for, and so we're grateful. As far as the economic health of our cities is concerned, you know, we can't go back in time and we can't change decisions that have been made, but going forward, I just think that it's important to stay loud and clear whenever we have the opportunity that municipalities are where the majority of people live, and they represent the economic engines of our province. And so for a healthy province economically, we need healthy cities economically. And for economic health, we need the health of the people. So any decisions that we make, I know that we are making on an evidence-based process with an eye to the physical, mental, and economic health of Edmontonians. And I just think that it would, I would feel like I wasn't, I would feel like I was relinquishing some responsibility if I didn't also, you know, advocate for that on a provincial level from our provincial partners to please talk with our administration, talk with us anytime, and to really, you know, as they have been doing, and maybe even redoubling their efforts, heeding the advice of our health professionals in order to ensure all aspects of health are being taken care of. The last thing we need in times like this is people thinking that maybe thinking that their best interests aren't being considered, and we want to ensure that that is the case. So thank you for that.
Thank you. Anyone else wishing to speak before we receive information? Going once, going twice, not seeing any. Please vote.
Yes.
If we could have Councillor Esslinger's vote, please, Mr. Chair.
That was yes.
Thank you. Display the vote. Carried. All right. That concludes the business for today's EAC. Thank you all. Thank you for the materials. Thank you for joining us, those of you who've joined us from Edmonton Police and from AHS. That's all. Thanks.